Marina Borukhovich is the CEO of YourCoach, which is a practice management software solution for health, fitness, and nutrition coaches. There are a lot of these platforms out there, but a few of the things that differentiate YourCoach include a reverse sliding scale for pricing. The more clients you have on the platform, the less it costs you, and the sharing of coach content from within the platform. So if a coach has built a really successful program in YourCoach, your coach will actually leverage it for you, helping to expand the reach of your programming. It was really fun to chat with the leader of an organization that is putting coaches first. Please enjoy. Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
All right, Marina, thank you so much for joining us today. How are you?
My pleasure. Hi, Laura. Hi, Erin. So good to be here with both of you.
Yeah, we've been trying to get this organized for quite a while, so we're excited the day has finally arrived.
I know. I'm so excited to be talking to both of you. It's a beautiful day. It's a great day for a conversation. So let's bring it. I'm excited.
Give us your backstory, kind of how you sort of got to where you are today and what prompted you to launch YourCoach. But, give us your origin story.
Like any entrepreneur, just kind of landed here organically because of my personal story. So I started out as a developer many, many moons ago. I was working for Lockheed Martin. And I do want to say that I have not coded anything for the platform. So we're safe there. I have not coded here. So, that's all good. Yes, I started out as a developer. I had a couple of entrepreneurial ventures. And then fast forward to about 8 years ago, I was diagnosed with breast cancer. I was 37 years old, prime of my life. We were expats at the time. We're living in Amsterdam. My kids were 10 and 12. I mean, we were living a beautiful life and just hit me like a ton of bricks. I was healthy, quote unquote, right? Like what you would think healthy is. I was exercising, I was eating right. I did all the right things. I had my kids young. I breastfed them both, right? Like you do all the right things. And then you find the lump and then that lump turns into 4. And all of a sudden you're a patient. So I became a breast cancer patient and I went through the whole journey. I had chemo, I had mastectomy, I had reconstructive surgeries, I had radiation. I mean, I pretty much had it all. And at the end of it, when I was kind of, my doctors, my amazing, amazing, amazing doctors who gave me my life back, and they said, go on, live your life. I felt so broken because while I was going through treatments, everybody was taking care of me, something was being done. And then all of a sudden it was just me, and it was terrifying. So I started hacking away at the pieces of my life and just trying to put everything back together because I felt that what was offered, what was out there, it wasn't suited for what it is that I needed, that I, Marina, needed at that time. I was 38 years old already. It was a little bit later. And the things that were offered to me were the same things that were offered to a woman who was in her 80s, to a woman who was in her 60s, or to a woman who was in her 20s. Like it was all the same things. For example, I always use this example because I think it just shows just how targeted like it is what we need, right? Like how personal everything is, because I wanted to box because that's literally the only thing that I felt I had control over because everything else was so out of control. And I didn't even mention to my doctors, like I was at the gym, I was boxing with my trainer, like no hair, just, it was like a sight, right? I told my oncologist about it years later. She's like, I'm so glad you didn't tell me this because I would have pulled you out of that gym. Like I would not let you do this. Right. But that's what felt right for me. Like I felt that this is what I needed. So started hacking away pieces, realized what I was doing was health coaching. The idea always appealed to me, went on to become a health coach. And here we are today. So I could keep going and going, but this is, that was just the beginning. Yeah. Like I became a health coach. There was nothing sexy enough as a platform to practice with my clients. created Your Coach, which started out as a practice management solution for health and wellness coaches. Fast forward to today, we're approaching 3,000 coaches on a platform who are using it with their own clients. And then we decided to take it a step further, and we became this operating system for behavior change powered by health coaches, where we create opportunities for health coachpreneurs. And this is with our industry partners to surround their product or service with health coaching services.
Oh.
That was a lot.
Oh, that's awesome. There's so much to go into here.
Yeah.
So your origin as a health coach, if I got it correctly, was that you were in the medical system now as a patient, and you weren't finding that there was any you-centric help. It was this sort of blanket cancer treatment. Everybody gets the same thing. You weren't being factored into it. Is that kind of?
So I felt the cancer treatment was very targeted. So the cancer treatment was actually amazing. That was targeted. It was everything else. It was the holistic aspect of it, right?
Gotcha.
What was available was therapy. And I was told to go to a therapist, right? Every cancer patient needs to go to a therapist. Okay, great. I'm sitting at a therapist and he goes, what do you want to talk about? I said, anything. The only thing I don't want to talk about is death. I don't want to talk about dying. I'm going to live. I have a lot to live for. So he goes, okay, so you're afraid of dying. Let's dig into that.
Oh my gosh.
No. No, right? So this is, needless to say, I walked out. I never went back there, right? It was the holistic approach to it. It was the one size fits all solution, which just did not jive.
Got you. Yeah. Good. Okay. Good clarification. So you went on to become a health coach. How did you do that? Did you take a course? Did you figure it out yourself?
Yeah. So we were living overseas at the time, and I really, Duke really appealed to me. That's where I wanted to go. But they had in-person classes. And I couldn't take away, 2 weeks at a time to go there. My kids were still little. So I went to IAN, which we know they're so great at marketing themselves, because when you Google health coach, it was IAN all over the place. Right. So that's where I went originally. And then I also went to Well Coaches afterwards.
Got you. Cool.
Yeah.
Amazing. Okay. So, and now you, it's so interesting because you have this development background, like you have that technology background. And also like, I think with a developer, it's sort of like this conceptual, I think developers are conceptual people. Like there's this hole in the marketplace that no one's filling it. This product needs to exist. So you created Your Coach. And it started out as a coaching platform, sort of a client management system kind of scenario where coaches could bring their clients in. What did the platform start? How did it start out? Like what were some of the functions and features of it?
It really started out for me. I never even intended for more people than me to use it. It was literally just me, myself, and I. And it was for me to communicate with my clients because there were other practice management solutions out there, but they started as web-based and then went mobile. And it was just a really clunky experience where, think back a few years ago, pre-pandemic, everybody was on their phones all the time, right? Like nobody was ever home. And I wanted something that was like mobile friendly, and created YourCoach.Health. And actually the name Your Coach, that was going to be my business name.
Oh,
YourCoach.Health, like your health coach, right? So that was going to be my little business. I was going to see 5-10 clients, and I was going to be happy with that. So the platform, it was really, first, it was just a chat feature for me to chat with my clients. It was ability to send photos back and forth. It was really basic. I wasn't even able to accept payments, or it was just, and then video. So first chat and then video, and then tasks, like tasks and to-dos. Those were the 3 main things that we had going.
Oh, I like that. Yeah. Mm-hmm. That's nice. That's a nice place to start. Like, I think we went through the process of vetting a lot of practice management systems, and that's all I wanted at first. It was like, just like, there's a lot of other stuff that these programs can have. And I want to dive into the other stuff that you've built in since this became an operating system, as you describe it, which I love that. That's a great term. But like, even when we're talking to our coaches about how to build their own program, it's like, that's kind of all you need. You need a communication tool. You need some way of providing the education and the support and the accountability piece. So that would be the tasks, right? Like, here's the thing to do. And then we communicate about it. And I feel like that's the coaching relationship really foundationally. So I love that you built that tool.
And you want that without all the extra noise. Because
exactly.
are there, right? Like you can go on Facebook and have a Facebook group, but then you wait for Facebook to change their rules or not be on, and all the ads are coming at you. Okay, great. You can be on Messenger, but everybody is in all sorts of different messengers, right? You can send information back and forth, but is it in my email? Is it in my chat? Like it's just so much noise.
Yeah.
It was just frustrating, right? So
that's what I found too when I was doing the research. It was like, I just got this sense that a lot of these programs were really bloated and had a lot of unnecessary features that were just kind of muddying the waters. And I wanted something like, I was looking for something streamlined that just really replicated the coaching relationship, like it would be in one-on-one.
Mm-hmm.
Yeah, absolutely.
Yeah, we get requests from many of our coaches for recommendations on platforms and systems and technology. And to a certain degree, so many of the programs that have every bell and whistle are so hard to figure out. They're not particularly intuitive. They become more expensive. They just get confusing. So breaking things down to what you really need, and then being able to add in things that might be unique to your business or unique to your clients that are helpful. So this kind of goes true to what we heard you said that Erin mentioned too. There wasn't a whole lot of you in sort of the aftermath and support of what was available to people. And what I'm hoping coaches are making the connection to is that this is what coaching is all about. This is the biggest Achilles heel of modern medicine, is that by the way it's built, I'm sure there's some necessity in here, is we have this top-down sort of public health, here are the guidelines for everyone approach to medicine, health, wellness, nutrition. And at the end of the day, there's no individualness to any of this. And this is why so many people struggle. Look, there's like one person who's average. Everybody else is going to fall along the bell curve. So this is where health coaching comes in. And this is where building a program that's got the flexibility in it to address the individual is so important. So what I love about your story is, and this is classic business development entrepreneurship, you identified a need in the marketplace that you couldn't find a already done solution for that resonated with you. So you built it.
Yep.
Right. And then went to market with it. And here's the other thing I love, that you leaned into the strengths and the experience you already had in your past that had nothing to do with coaching, but found a way to fold that expertise in to your business and sort of what you're doing. So health coaches listening, I hear this all the time. Well, I don't have a background in nutrition, or I'm not a doctor, whatever. I came from law or sales or whatever. Right. I was an English teacher. Okay. There are skills that you've developed that you can bring to the table as you build your business. And so first of all, I want to applaud you for doing that. And I want coaches listening to this to recognize that and think, gosh, what do I have? What are my strengths? What are the things that I've learned professionally or from my education that I can bring into my program and what I do that helps other people? Because I promise that it's there. So would you mind telling me a little bit in terms of when you built your practice management system, at least initially, again, kind of reiterating what you felt was the most important in your initial kind of launch. And then as you went to branch that out for other people to use, what you might have added or changed.
So I'm just making some notes for myself because there's so much to unpack in what you just said. And I just want to cover all of it. Right.
Yeah.
So first of all, I appreciate, thank you for all the kind words, but, one thing you hit here is flexibility. And we have, we're a team of 30 now, we're growing rapidly, and we've come far away from, like me and a back end guy and a front end guy and half a designer. Right. So it's been a long way. But when my developers, when we talk about features and they're building it out, they want exact specs. What are we doing? But you said it has to work this way, but I'm like, no, we need to be flexible. We need to be absolutely flexible, because while this platform was built for me as a coach, it doesn't need to work for me as a coach. It needs to work for everyone. So when we put a feature in place, we're already talking about how can we improve it? What's the next iteration of it? We have focus groups all the time. What do the coaches need? What are they looking for? We don't put a feature out there thinking about, okay, this is going to be the best feature, and right now we're going to put it out and it's going to solve everybody's problem. No, we put a feature out there and then we get feedback on it. And once we get feedback on it, we make it the most incredible feature that it could ever be. right? We want it to be intuitive. We want it to be easy to use. We want coaches to come back and use it. We want their clients to use it, because if their clients are not using it, coaches are not going to be using it. Nobody wants to use a solution that's not comfortable for anybody, right? And then another thing that you said about using your know-how and building a business, you're right. Like there's so many young women that are working with me, and I love our exec team. It's a lot of women. My operations people, they're women. My product person is like a young woman, right? Like I adore it. And my goal with all of them is when all is said and done, when your coach is this unicorn and everybody's like super happy, I want each one of them to go out and to be able to build a business. Whether or not they want to do it, that's up to them. But I want them to have all the know-how in order to do it, because building a business, it's all the same. It's sales, it's marketing, it's development, but it's people. It's about people. It's about building teams, right? So it's absolutely what you tell coaches all the time. You have the expertise. It doesn't matter where you came from. It doesn't matter what your background is, right? Use that to your advantage. Use that to help people. There's no one-size-fits-all solution. And a lot of coaches come to the platform, and the question we get asked most often is, well, can you help me build out my program?
Okay.
Mm-hmm.
Help me build out my program. No, I mean, it would be easy for us to put something in place. It would be so easy for us to put that, out of the box cookie cutter program. We don't want to do it, because that's not what we do. We give you all the tools to build out your program. Besides having all the tech tools, we have webinars all the time. We have symposiums all the time. A lot of ways for coaches to level up their knowledge and skills, right? We're not going to do the work for you. This is what you bring to the table.
Right. Oh.
That's huge.
Okay.
That's huge. Look at Erin. Erin's like, okay, I'm all over this.
I told you there's a lot to unpack, right?
Uh-huh.
My first question is, you won't build programs for coaches, even though they ask you that. Why?
Because this is not a cookie cutter approach. It's very individualized. It'd be really easy for us, but this is, we don't know how to build programs. I know how to build programs for my clients. I know how to build a program for me. I don't know how to build programs for your clients. I don't know who your clients are.
Thank you. Mm-hmm. Okay. Yep. I'm so excited about this. And I really do want coaches to, again, hit that 15-second back button, listen to this again, listen to this again, listen to this again. Because I would say that's probably the question, the second most frequent question we get. First is, how do we find clients? And then how do I, are you going to build a program for me? Because we're a health coaching educator, we're a school. We certify coaches, we certify you, we train you to coach. And it's like, great. Now are you going to build me a program? It's like, how am I going to build you? How am I going to build your program? Like, you're a unique health coach with a completely unique audience and a completely unique point of view. I don't know how to build your program, but hey, let's teach you how to build it. Like, I really, honestly, this is an empowerment message. Like, put on your big person pants and make a program. It's not that hard. I think there's people who are non-techie or who have never project managed. Maybe that's not part of their previous life or whatever. And they think this is out of scope of me. I don't know how to build a thing. It's like, it can literally start by being some PDF ebooks or whatever that you email to people like that. We can do this real analog, but you have to build your own thing. It has to be your thing. It has to be the unique service and product and solution that's for you, for your clients. So I'm just like over here fist pumping. I completely agree. Not because we don't want to support coaches, but because we literally can't do that for you. It would be a total disservice to you and your clients if somebody built it for you.
But I feel that's supporting them. Like, I feel that's supporting coaches. Doing that is supporting coaches, right? Like, we give them the platform, we give them technology to deliver that. You don't need to email it. You don't need to carry it over. You don't need to send them anything. We give you the platform, literally step by step. Step 1, what is the name of your program? Step 2, what materials do you want to share with your clients? I mean, we see a lot of, and just, I'm going to go out there. I'm going to say this, we see a lot of graduates from a lot of different schools. And there's great schools out there where coaches come in, they know what a program is. They know how to build it out. They know what information they want to share with their clients. And then there's schools where coaches come in and they say, build me a program.
Yeah.
It's the same. It's all the same schools. It's all the same education, And we just recently, we put together a health coaching report, and we approached a lot of health coaching schools. And we asked for, how many graduates do you have? What kind of programs do you run? What is it that you do? And there's wonderful schools who were very transparent, who gave a lot of information, but there are schools who were really holding that in and did not want to share any of that. I feel like there needs to be more transparency in this field. That's the only way that we can grow. If you're doing something amazing, if you're doing something great, if you have such a great program that you stand behind, share it with the world.
Right. Yeah.
Listen, there's going to be copycatters out there, but nobody's going to be able to copy your vision and your passion for what it is that you're doing. Right. Mm-hmm. And that's like a lot of coaches as well. They're so afraid to put information out there. They're afraid to put their pricing and what they're going to be sharing. But that's just that. That's just information. If it was so easy, everybody would be able to Google things and heal themselves and help themselves. And, just life would be wonderful. Like, it'd be so easy. But
yeah. And I think there are schools too that I'm not here to disparage other schools by any stretch of the imagination, but there are, because I think Laura probably gets this a lot when she's on the phone with prospective students at our school, which is, well, this other school is going to build a website for me, and this other school is going to give me a program done for you. Mm-hmm. And to be honest with you, I created a program for our school because we had so many requests for a program. It's like, okay, fine, I'll create one, but I don't like it. I'll do it.
Well, but you also built it to be customizable, right? She built it so that the coach could go in and put the
disclaimer in the front of this program is, okay, this is a template and you're welcome to use it, but please build it out separately, build it out in your own platform with your own colors, use your language, rearrange it in the way that makes sense. Like, in a way, it's just a template, like, oh, that's what a program is. I think that's what it is. To your point, a lot of schools aren't teaching what even a program is. Right. I gave a talk at KetoCon this past year, and there was coaches in the audience, and some of the coaches were asking questions about, like, I can't get my client to understand this. I can't get my client to do that. Why won't my client do this? I'm like, this is all programming. Like, you need to program that. And you could almost see like confusion, like, programming? Like,
what's that?
it's not even on their radar. So anyways, in creating our program, I put it on their radar. But I think there are some schools that are just giving coaches programs, and coaches think that's what they want and need. And I just don't think they do. I think it's a very disempowered position.
I think so too. Yeah. But then again, that's why there's a lot of different schools out there. What is it, like over 150 schools at this point, right? And that's why there's so many different people need different things, right? Mm-hmm. And while anybody can bring their own clients on our platform and practice with their own clients, for us to give them our clients, for us to give them opportunities, that is absolutely not going to work, right? Like, we need to make sure that you're a great coach, that your clients are reaching their goals, that you understand the scope of practice, that it's an individual approach, right? It's not everybody who calls themselves a coach is a coach.
Right. Oh, yes. This came up on, spoiler alert, you guys have developed this annual global symposium for health coaching. And I was moderating a panel, and this came up as a topic of conversation on the panel as to the number of people that are calling themselves coaches that aren't really coaching. To what Erin was saying, they might have a program. Yep. There's no real coaching in there. It's information. It's, there's aspects and pieces of what coaches bring to the table, but it's not really coaching. And, our school's been around for 7 years now. People had been asking for us to, hey, are you just going to give me a done for you program? We pushed back for years. Nope. Mm-hmm. We're not going to give this to you. Here's an outline. Here's some infrastructure. Here's some forms to kind of use the term Erin used. This is an example of what it can look like, but it was very low tech. And so the next thing was, now take this as your starting place, your chassis, and decide how you want to deliver it. Put it into your language, adjust these things. And we are one of the few schools that survey our students and graduates every year. And this kept coming up as kind of where they were stuck, because I think this goes to confidence.
Yep.
I think this goes to people maybe lacking some experience in creating content and having the confidence to build that. So we felt was, okay, if we can, first of all, you're going to have to pay for it. If you want this program done for you, you're going to pay for it, but you've got to give it your own name. We want you to go through this thing with a fine-tooth comb and find ways to make it yours. And my prediction is going to be that people that buy that are going to be new coaches that just want to get out there and get started. Yep. And then over time, we'll realize that when they deliver their own program, it's so much better. And they're going to find that. So this is kind of like training wheels is kind of the way I look at this as people gain confidence and get out on their own.
I like that you have a disclaimer on it, right? Like, just kind of use this with caution, this is starter. This is like a starter set, right? And then, but you're right. Like you hit it right in the nail on the head is coaches lack confidence, right? Like it's the practice. We always tell them practice, practice, practice. But I feel like they graduate and it's that now what? What do I do now? Right. There's that imposter syndrome. We don't want to talk about, we're not sure about what we're doing. We're not ready to talk to our friends and family about it. We're not ready to put it out there. We don't even know how to talk about what it is that we do.
Right.
Right. Like the whole definition of a health coach, that's all over the place as well. So there's just so much there. I'm all for, but it's like teach a man to fish, right? Kind of,
yeah.
Right. We can create programs and we can give tools, but at the end of the day, we just need to give enough education to create good coaches, like to help to keep leveling them up, because there's constantly new information out there. There's constantly new learnings, right? And we continuously have to support that. So, yeah. This is like preaching to the choir.
Oh yeah.
When I first met Erica, she was a skilled health coach who couldn't seem to make the leap from her 9-to-5 job to a full-time coaching business. She was struggling to find clients and to identify what made her unique as a coach. Well, I've met tons of health coaches in that exact predicament, which is why I partnered with Primal Health Coach Institute to develop the Launch Your Coaching Business program. This course is specifically designed to help you hone your niche and graduate with a sure-to-sell product. Erica enrolled and created an awesome specialty program that brought in so many clients and so much passive income that she was eventually able to tiptoe into full-time health coaching. This course includes 12 weeks of live, hands-on workshops with me, Primal Health Coach Institute Coaching Director Erin Power, and my co-teacher, best-selling author and coach Liana Werner-Gray. It also includes an online course that helps you get clear on your specialty, know exactly what your client wants and needs, and then create a program to meet those needs. Then comes the practical how-to for getting that product out into the world and into the hands of the people who need it and who need you. We keep the class small so you get the high-touch support and guidance you need to get your product to market fast. If you are ready to get your health coaching business off the ground, visit primalhealthcoach.com to learn more about the Launch Your Coaching Business course.
Now, confidence is the biggest thing. And in fact, I was on the phone with somebody who graduated from our program or was about to, and she was frustrated as she was kind of winding this down. So I called her because we do that. You know, if somebody is expressing a frustration or a concern, we're going to reach out and be like, let's talk about it. And by the time we got about midway through our conversation, she finally admitted, this is just me in my own headspace, and I'm lacking the confidence. And I was hoping that by graduating from this program, it would suddenly give me confidence. She's like, I feel like I know a lot. Like one of the things going through our program solidified for her is she already knew a lot, right? The coaching portion of what we teach too was a bit of an eye opener for her. Hadn't really done that before. And the business side of things, she finally admitted because of her, again, a little bit of a lack of confidence kept her from really going through those business steps deeply. She kind of did them, So anyway, at the end of the day, she's like, I just lack confidence. I go, so what's the antidote to not having confidence? What do you think is going to actually bring the confidence? What do you need to do? And she goes, you need to just do it. I go, exactly. That's how confidence comes. Get out there. You're going to feel uncomfortable, but do it. And that's where confidence comes from, is through experience. So the number one thing, coaches listening, the world's greatest program, the best operating tool, all of these. Here's the other thing I see marketed on Instagram and stuff are done for you content. An entire book of stuff that you can just plug and it's done for you. What? You don't get good at creating content until you start out kind of bad or mediocre. And then you get some feedback. You get better at it.
Exactly. Yep, absolutely. You need feedback. You need that real world data. You need to see what's jiving with people, right? Yeah. If it was so easy and everybody could buy that done for you content, everybody would be sitting here millionaires, because did you hear you can sign 10 clients in a month at 10,000 each? Like, it's amazing.
Yeah. And I think the other thing too, and we're really kind of banging this drum extra hard, but what the heck is, we have to go back to our calling. So like the very first business exercise we have people do is like, what are you doing here? Why are you a coach? And it certainly wasn't to deliver somebody else's cookie cutter program. You had some kind of personal calling. We all had it. We all had one. Everybody listening had one that's very unique to them. No two are the same. Yep. So why would you want to? It's almost like going to work for somebody. It's like you're breaking out of that paradigm. You're doing your own thing. So do your own thing. You want to do your own thing. So do your own thing. This is your chance. And I absolutely have all the, I acknowledge that it's hard and it feels weird and it's a massive pivot for most people. But hey, just get her done. Just go do it. You can do it. You can do a pep talk.
And we see what cookie cutter does, right? Like we see what's happening in the industry. We see massive layoffs in companies that do have the cookie cutter approach that call it coaching, but that's not real coaching, right? It's more of the nudging and sending articles. And it's not real coaching. So until we start practicing real coaching and calling it real coaching and getting real coaching outcomes.
That's right. Mm-hmm. That's what I was going to say is that's the overlooked piece of this equation is getting amazing outcomes. So that goes back to your origin story, coaches. Like you had an amazing outcome, probably. We all did. So now we're going to take that. And that's the thing that I want to manipulate for other people and encourage for other people. That's the little piece of the health pie that I'm interested in. That's the only thing I do. Like I only do insulin resistance because that was my health struggle. I don't touch anything else. I don't know about thyroid. I don't know about menopause yet. I'll soon find out. Right? Like that's that's the one thing that I do. And I love that I only do that one thing. I love feeling like a specialist and I get outcomes. I get good outcomes because I specialized in that thing that's important to me. And I built a program around that one thing. I think people really think they have to be all things to all people and be out there and be an influencer and all this stuff. And it's like, no, you have to get outcomes. And the way you're going to get outcomes is by tagging to your own health story in some way or another, or what you've learned along the way. So really important stuff here. We've covered programming is important. We've covered outcomes are important. Let's get back to talking about your coach. So it started off as a coaching platform for you to bring your clients in. And now you're calling it an operating system, which I absolutely love. I'm obsessed with that terminology. An behavior change operating system. And this is now client facing. So did I get that right? Like you're bringing clients in to work through programs on the platform?
So there's so much to unpack here too. So that's why we're category creators. So we're creating this category operating system for behavior change powered by coaches, right? So what it looks like, it's a two-sided marketplace, but not a typical marketplace, right? Because in a two-sided marketplace, you have a directory on one side and you have health consumers on the other side, or any other consumer. So what we have the practice management part, right? Which helps us identify the coaches that we want to work with, that we want to contract with, right? So while anybody can bring their clients onto the platform, and Laura, you asked me before, and I completely overlooked that question. What does the platform offer? It offers absolutely everything from onboarding your clients, accepting payments, signing contracts via the platform, to setting up programs, those programs that we talked about, to-dos, goals, long and short-term goals. You can do client notes. I mean, pretty much anything you need to run your business, you can do on a platform. And then we have this gamified pricing system where coaches come on a platform and they start with $40 a month, but nobody actually pays $40 a month, because while you have those free programs that you have, so when you first come in, you have you can have 2 individual programs and 1 group program for free, and you can run them for as long as, if that's the only thing you run for the rest of your life, that's fine. You have the platform for free, but you accumulate points for all the activities that you do. So you accumulate points for inviting clients, for sending contracts, for creating goals, pretty much for everything you do as a coach. And during that time, the more points you earn, the price of the platform actually goes down. So we have this, the more you practice, the less you pay.
That's awesome.
Right?
That's so
it's
different.
Crazy. We like turn it on its head, right? So by the time you finish, like with your free clients, you're already at like $25 or $30. So nobody ever pays $40. And then it can get down to $10 a month for this full practice management platform with all the features, like absolutely everything that you could possibly need. So we have that on one side. So coaches use that with their clients, and then we identify the coaches that we want to work with and we contract with them. On the other side is we're not direct to consumer. Our clients are companies, right now is digital health companies who are looking for health coaches to surround their service or product.
Okay. Gotcha.
And we carry the contracts, we contract with the coaches, and they're able to work with the clients of our industry partners.
Oh, that's cool. Everything about that is so cool. Like your pricing model is literally upside down from every other.
This is what we
pricing.
do. This is what we do. Sometimes I feel like, I don't know, you guys are probably too young for this, but there was this like Crazy Eddie back in the day. And he's like, and the price goes even lower.
Oh yeah. I remember Crazy Eddie. Mm-hmm.
Yeah, Crazy Eddie, so I feel like Crazy Eddie sometimes.
That's a US.
Yeah, totally US reference. Yeah. So it's like, and it's even less.
It's like an electronics store or something like Crazy Eddie's.
It was like, I was a kid at a time, but he was fascinating, this Crazy Eddie. He was always slashing prices. And that's what I feel like we're doing. But I feel coaches need to be rewarded for doing their great work.
Yes.
Like, why do you need to pay more the more clients you have? Why? How does that make any sense?
Yeah.
You're doing a great job. You should be rewarded for that great job, right? So this is what we have. We have the platform. We have a community for coaches. We have Rebecca is our community manager. I think, Laura, you've met with her. She was one of the first people that we hired because we felt community was so important. And we truly have a lot of events. She has events with coaches all the time. We bring in speakers. They're eligible for, a lot of them are eligible for CEUs from BHWC. We don't charge anything for the events. For the symposium, we charge this year only for CEU tickets. And all of that is going towards the scholarship that we have, which is in honor of my parents. It's in their memory, and it's providing board certification to coaches who are not able to afford it.
Oh,
so all of that. Yeah, like every penny from those sales is going. But if you don't need CEUs, the symposium is free as well, right? Like we provide all these opportunities for coaches to level up their business. We give them community, we give them a platform, and we have more client opportunities. Because while coaches are truly amazing at coaching, a lot of them, maybe not great business people who wants to go out there and, we know how hard it is to find clients, right? So we take that lift. We do that. So,
wow.
So tell us more about, so you've got these digital health-based companies that maybe they don't want to hire their own health coaches. That's, an operating expense, sometimes depending on where you are and the size of your business, there's benefits you need to, all this other stuff, versus partnering with an organization like yours where they can tap into the health coaches on your platform. I love that idea. Yeah, I love that idea. And was it like that from the beginning, or did a company approach you and you're like, oh gosh, we could totally scale this? Or was this something that's like, what we need? Again, here's a need in the marketplace. Let's do this.
So this was always the plan from day one, I'm not going to say from day one, from like day 5, right? Because from day one, I was just creating a platform for myself. So from day 5, when we realized, a lot of coaches are coming onto the platform and using it, we realized that we can do so much more. So that was always the goal. But for the past 2.5 years, we focused on building the coach community. We focused on building the trust and giving value to the coaches, right? Because there's so much distrust, and rightfully so, in the industry today, because companies are saying one thing, they're doing something else, right? And from day one, we've always put our money where our mouth is, or mouth where our money is, one of those, right? Like we always did what we say. So we built that trust with coaches. We gave them value for what they needed, and stealthily, we've been working with digital health companies in order to offer these services. And just earlier this year, we went live with that offering.
Amazing. Can you describe, at some like maybe a high level, how these relationships work? So like, what's an example of a company that you don't have to name names necessarily, but do you have an example of like how the companies work with you and with the coaches?
Yeah, so there's several companies. One that I can talk about freely is Twill Therapeutics. They're formerly known as Happify Health. And through them, we power up large employers and health plans. So so they're large employers and health plans. They have the Twill digital therapy for their employees, for their talent, and whoever wants health coaching, whoever qualifies for health coaching, that's done through us, the life coaching components.
Amazing. Gosh, that's so cool.
So
Wow.
and the way this works is we integrate into the platform. So the clients never need to leave the Twill platform, for example. They never need to leave any of our clients' platforms. It's a very organic experience for them because we plug in APIs and widgets. So for them, they sit on the platform. They say they want to talk to a health coach. They're talking to a health coach. Meanwhile, coaches are sitting on the YourCoach platform, and it's a very comfortable experience for both parties.
Oh, nice.
And it's about sticky situations. It's about relationship building. It's not one-offs. It's not like I want to talk to a coach now, and you talk to a coach now, and then you forget about it because we can't solve anything in half an hour.
Right.
It's coaching, right? It's not episodal. So it's all about long-term relationships. It's about that right client coach match.
Okay.
We want these relationships to last for a really long time.
Okay. So I'm getting into the weeds. So I love that it's integrated into the client's platform. So are they assigned a dedicated coach, or is it kind of whoever's online at the time takes on the coaching conversation? It sounds like it's a dedicated coach to the client.
So we have matching algorithms. Yeah. So we filed some patents around it. We have pretty impressive matching algorithms, and we match them on a lot of different criteria. And we want to make sure that it's a relationship that's gonna flourish.
Amazing.
So when a coach joins YourCoach.Health, do they have the option to be able to do both, to be contracted to work with some of these larger companies, but also have their own sort of private practice where they're using your platform to coach their own clients separately outside of this contract? Or is it
that's exactly what it is. When they join YourCoach, they're just joining to practice with their own clients. It's not like you can just because you sign up to the platform, you don't get that opportunity right away. There is a process that we go through. There is a verification and validation process that we go through. It's a pretty intensive process, but once you're contracted with us, then you have a lot of these opportunities, right? So it's
what's that process like? Because here's why I'm asking.
Yep,
is I get a lot of questions about how important being national board certified is. Mm-hmm. Anyone in the health and wellness space that understands health coaching, being national board certified will open a lot of doors for you. It will create more opportunities. They're not a regulatory authority. You don't have to have that. However, if you want to, so this is why I'm asking in terms of the vetting process, is that one of the things you're looking for, aside from the fact that they're a certified health coach holding an ICF or a national board or UKICA or any of those things? How important is that? And is that a part of it?
For us, real world data is more important than national board certification. So for some of our clients, that comes into play, and it's important for them that it's a nationally board certified coach, and we can certainly deliver on that. But for some of our other clients, it's about the matching algorithms. It's about the quality of coaching, right? To make sure that they follow the scope of practice, that their clients reach outcomes, and the certification is not so important.
No, you know what? I love that because what I don't want is for coaches that don't hold that credential right now or are unsure if they can afford that right now. Don't let that stop you from moving forward and going ahead and applying for a position that you think really sounds like it's right in your wheelhouse. That experience matters.
And, we can turn it actually the other way also. I mean, there's a coach on the platform. She holds 19 certifications, 19, including national board certification. This coach has not practiced a day in her life. She's continuously getting certifications. She's creating programs. She's asking a lot of questions, which we love. We love questions. Keep asking. But she's never practiced. This is not anybody that we'll ever contract with until she starts practicing. So she has all those certifications. Does that make her a great coach? I don't know. I mean, it could. I don't know. I don't know what she does out in the real world.
She doesn't know either.
We have no idea. Yeah. So a certification is just that. It's a certification.
I love that. I love that you're paying, you take into account the coaching mastery, the mastery of the skill of coaching. I love that you put scope, in some cases, the scope of practice is brought into the spotlight. Sounds like some of your partners
always,
that.
Always. That's always, because we're building out world-class coaching service. It needs to be top nudge. If it's something that a company that we're talking to, if that's not what they're looking for, if they're looking for those nudgers, that's not us. This is not what we do. There's other companies out there that can deliver that, but we stand behind every coach that we contract with.
Amazing. Oh gosh. Okay. So I want to kind of summarize what we talked about here about the app. And then I think we should move on to the symposium just to talk about that a little bit. So this app is, so first of all, coaches can sign up for it and coach their clients through there. That's how it was built. You gamified it. So the more clients you have running through your programs, the less you pay. I see no barriers to any reason why a coach would ever join this club. And then you as an organization are paying attention to coaches who are having pretty good outcomes, and you might invite them to be part of your sort of roster of coaches that then works with these other companies. That's amazing. Wow. What opportunities. I mean, opportunities abound for coaches. Boy, oh boy.
So it's an app, but we're also web-based. So it's web-based. Okay. And so we started out as an app, but then pandemic happened and everybody was in front of their computer. So we really quickly developed the desktop version as well. So
that is true. That is so true. Just as a complete sidebar, I'm so much more on my computer now than I am on my phone. Like I might as well just pop open the laptop and do the thing I was going to do on my phone. That's so true. We have completely shifted. Not everybody, but yeah.
I know. But I think like it's good to have both, right? If I want to put content into my programs, or if I want to leave some notes, I'm going to do that on my computer. But if I want to have a quick chat, if I want to message my client, I'm still going to do it through the app. Or if I want to do a video call, like while I'm in my car or something, right? Like I can do that. So
yeah, I mean, I started posting on Instagram on my laptop. I don't even use the phone app anymore because it's a pain in the butt. Anyway.
It is, right? No, I totally agree with you. One thing I didn't mention is that the platform is HIPAA compliant. So
nice. Okay. Good. Another bonus. Boom. Yeah. Okay. Wow. Okay. So the symposium. So Laura moderated a panel on the symposium. So I know nothing about the symposium. I just learned that I can get my MBHWC CEUs, which I'm very excited about because I'm way behind the ball on getting those. So I'm going to definitely pay attention.
Yeah.
All of them? Oh, I'm in. I'm in. Sign me up. I will swipe the credit card for that. That's the kind of CEU collector that I am. I'm the panic type of CEU collector. Like, oh my goodness, I need them all. Okay. So your 80-page report's coming out in late November. So this is airing in February. So it's out and accessible to people.
Yes, absolutely.
And should we talk about that or the symposium? Where do we go from here? Are they related?
There's so much to talk about. I mean, it's all related, right? Because our theme this year, it's demystifying health coaching, because we feel that there's still so much mystery around it. And it's for both coaches who sometimes are not really sure how to talk about what it is that we do, right? It's about for health consumers who are curious about what coaching is. And it's a lot for companies who want health coaches to surround their product or service. So we've been doing a lot of demystifying this year. It's been through webinars. It's been through the symposium. It's been through this report. I mean, this industry report, we came out with our first version 2.5 years ago. We were just babies, just starting out. And it was, it was just the beginnings, right? And this time we have so much more data in there, so much information. We talked to over 100 experts. We have over 50 studies that are in there on health coaching and efficacy of health coaching, right? So very, very proud of all this information that we put in there. There's data from the coaches on our platform. There's data. I mean, we spoke to you guys as well. You gave us so much wonderful information about your school and about what the coaches do. So super proud of this report. Very much looking forward to that coming out. The symposium, that was demystifying as well. So we have experts from digital health companies. We have coaching experts. We have international experts, right? We want to just bring everybody together and demystify it for all the parties. Another thing I would love to talk about, if I know like we're running short on time, is the scholarship that we have. And I touched upon that briefly, and it's a scholarship in honor of my parents. And we provide 5 recipients for each exam sitting of an NBHWC exam with full, we cover all the exam fees and the prep work leading up to the exam. And so we do that for 5 sittings a year, and with the money that we're making on the symposium for the CU tickets, all of that, every single penny is going towards the scholarship as well. So if there's any coaches that want to apply, and so this is need-based. We don't ask you for your W-2s or anything, right? We want to hear your story. So it is need-based, but it's also based on your passion for health coaching and what it is that you're going to do with it, what it is that you're going to put out into the world, because it is our belief, and everything that we do here at Your Coach, it's everything that I believe in as a person, that it's towards happy and healthy humans, because we believe that health is happiness and happiness is health.
Yes.
So
the scholarship covers the exam costs and any prep costs. So that would maybe like a study group, but it doesn't cover the certification that they need to get to, or does it cover their training as well?
So they need to have finished the accredited program, right? So we cover the exam fees and the study group, the study prep, and the exam materials.
That's nice. Wow, wonderful.
Yeah.
Well, how do people apply for that?
So everything is on our website. It's YourCoach.Health. We're YourCoach.Health on all the socials. There is a banner right on our front page towards scholarship. It's also in a footer. And you can also nominate somebody. So if you feel that there is a coach that could benefit from this, you can nominate them, and my team will reach out to them, and we'll speak to them as well.
Nice.
I love that. Awesome.
Yeah.
So the best place for people to find out more about you and Your Coach is the website, or do you have social media that you do a lot of posting on? Where can people kind of follow you and learn more?
We're everywhere. If you're on social media in any corner of the world, we're on there. So we are Your Coach Health on LinkedIn. We're on Instagram. We are on YouTube. We're soon to be on TikTok. We are everywhere. So we're even on Facebook, which is a little bit of a black hole, but we're there anyway. So.
Oh my gosh. I love how people talk about these social platforms. We're even on Facebook. We're going to do TikTok.
TikTok you got to be so careful with, right? It's just there's a fine line on TikTok, but
I agree.
But we meet people where they are, right? So
exactly. That's what we talk about in all of our business training is in terms of the use of social media. The whole point of it is being where your audience is. So if your audience is not on TikTok, you don't need to be on TikTok. If your audience is on LinkedIn, that's where you should be, right?
Yeah.
You don't have to be on all of it.
Yeah. And it changes, like our content is different depending on which platform we're on, right? Interactions are different with the different clients. And if it depends if it's a coach, if it's a potential client, if it's a health consumer, right? Interactions are different as well. So kind of got to be everything, everywhere.
Wonderful.
Awesome. This is so great. Thank you so much. I'm glad we finally kind of got you on here. We were able to connect. This was awesome.
This was so much fun. The time just flew by. I feel like we could talk for another hour, but thank you both so much. This was lovely. It was so much fun.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.